I chose to talk about the chapter 13, which is motivational interviewing for intimate partner violence. So this can include emotional abuse, physical abuse, psychological abuse with any partner or close relationship. So there isn't a lot of research for how effective and efficient MI is with this population, but it shows considerable promise in preventing and treating IPV across a range of populations. Treatment for IPV is often compelled by court order or by other external forces such as pressure from a partner. So most of the time there is going to be some resistance with clients who are struggling with IPV. Typical treatments for IPV include couples therapy, group treatment, and universal prevention programs. MI can also be helpful to use when substance abuse is a key factor in IPV, because reducing alcohol use can lead to less physical IPV, psychological IPV, and fewer injuries to partners. So working with that client using MI, if they are struggling with substance abuse and IPV, is very efficient. MI can be helpful to increase attendance and engagement, especially in group treatment. Most studies also demonstrate an increase in readiness to change as a result of MI. Low motivation to change is seen as a primary problem in traditional IPV treatments. So with this chapter, it basically talks about how incorporating MI in the traditional treatments would be the best thing to do. It overcomes many of the limitations of existing treatments. So, although there is limitations for MI for IPV, because oftentimes it doesn't last long term. So this chapter talks about incorporating booster sessions like 6 months after ending the MI sessions in the treatment. So there still needs to be a lot more research and studies on MI with intimate partner violence, but it is promising. So that's what I got out of this chapter.